As we all know, every human body has two kidneys, which are primarily responsible for filtering the blood free of nitrogenous waste products like urea, creatinine, acids, etc., all of which are products of metabolism in the body and produce urine. Millions of people are living with various types of kidney diseases, and most of them don't even have the faintest idea about it. This is why kidney disease is often known as a silent killer, as most people do not feel any difference until the disease is advanced. In today's video, we are going to discuss with you all some early signs of kidney failure so that you all can watch out, and if you feel any of those symptoms, you take urgent measures. But before we move forward, if you like our videos and content and don't want to miss out on any of them, hit the like, subscribe, and bell icon. There are a number of warning signs of a kidney disorder. However, most of the time these are ignored or confused with alternative pathologies. Therefore, one has to be very watchful and should get the confirmatory tests including blood, urine, and imaging done at the earliest appearance of any sign of a kidney disorder. While the only definitive way to diagnose a kidney disease is to get confirmatory tests done, here are some early warning signs of kidney diseases which might end up in the failure of these organs. Swelling over the ankles or legs. When your kidneys can't get rid of sodium well, fluids build up in your body that may lead to puffy hands, feet, ankles, legs, or a puffy face. You might notice swelling especially in your feet and ankles. One will start to notice edema at these sites which pits on applying pressure and is termed as pitting edema. Any person noting new onset pedal edema should get an immediate evaluation of his or her renal function after visiting a nephrologist. Weakness. Early fatigability is almost always a universal symptom of kidney disease. As renal dysfunction progresses, this symptom becomes more and more prominent. One may feel more tired or exhausted than on normal days and will be unable to perform more strenuous activities, thus requiring rest more often. This is largely due to the accumulation of toxins and impurities in the blood, resulting from poor kidney function. Being a non-specific symptom is often ignored by most of the people and not thoroughly investigated. Low appetite. Kidney disease can cause nausea or vomiting and upset your stomach. That may leave you with little craving for food. That sometimes may lead to weight loss. Secondary to the accumulation of toxins like urea, creatinine, acids, the appetite of an individual is suppressed. Also, as kidney disease advances, there is a change of taste, often described as metallic by the patients. If one gets the feeling of early satiety in spite of barely having anything during the day, it should raise alarm bells in one's mind, and one should get his or her renal function evaluated. Early morning nausea and vomiting. Another one of the earliest signs of worsening renal function is the presence of early morning nausea, which is often classically described as hitting the person when he or she goes to the bathroom in the morning for brushing his or her teeth. It also contributes to the poor appetite of the individual. At end-stage renal failure, the patient tends to have multiple episodes of vomiting and complete loss of appetite. Itchy and dry skin. This may happen if your kidneys can't flush out toxins and they build up in your blood. That can cause a rash or make you itch all over. Over time, your kidneys may not be able to balance the minerals and nutrients in your body. This can lead to mineral and bone disease, which can make your skin dry and itchy. Dry and itchy skin can be a sign of advanced kidney disease. Blood or foamy urine. When the filtering mechanism of the kidney has been or is being damaged, protein, blood cells start to leak out into the urine. Bubbly pee could be a sign of too much protein called albumin that can result from kidney issues. So can brownish or very pale urine. Faulty kidney function also may let blood leak into your bladder. Blood in your urine also can be caused by kidney stones, tumors, or an infection. Change in urine frequency. One has to keep a very careful watch on his or her urine output. For instance, the urinary output may decrease, or you may feel the need to urinate more often, especially at night. It can be a warning sign and may indicate that the kidney filtering units are damaged or in the process of being damaged. Breathlessness. When you have kidney disease, your organs don't make enough of a hormone called erythropoietin. The hormones signal your body to make red blood cells. Without it, you can get anemia and feel short of breath. Another cause is fluid buildup. You might have a hard time catching your breath. In serious cases, lying down may make you feel like you're drowning. It is one of the common complications of kidney disease. This can also cause weaknesses and fatigue. Abdomen pain. Pain in the back, side, or below the ribs can be an early symptom of kidney disorder, like renal calculus or pyelonephritis. Similarly, lower abdomen pain can be associated with bladder infection or stone in the ureter. Such symptoms should not be ignored and investigated further by a routine imaging study like X-ray, KUB, or ultrasound abdomen. High blood pressure. A presenting sign of kidney disease may be high blood pressure. Any person being diagnosed with hypertension must have a detailed workup of renal functions and kidney imaging to rule out renal etiology of hypertension. As kidney function deteriorates, there are sodium and water retention leading to high blood pressure. Symptoms of hypertension include headache, abdominal pain, visual blackouts, and may be the early presenting symptoms of kidney failure. Many kidney or urinary tract conditions lead to kidney failure when they are not properly managed. You can help reduce your risk of kidney failure by maintaining a healthy lifestyle, following your doctor's advice, taking prescribed medicine as directed, treating common causes of kidney failure, such as high blood pressure and diabetes. One of the important considerations impairing the kidney function is the diet. Including some special food items in your diet can contribute to well-working of kidneys. The food items may include fruits such as banana, avocado, apricots, and additional amount of yogurt and sweet potatoes. There are a number of physical signs of kidney disease, but sometimes people attribute them to other conditions. Also, those with kidney disease tend not to experience symptoms until the very late stages. When the kidneys are failing or when there are large amounts of protein in the urine, this is one of the reasons why only 10% of people with chronic kidney disease know that they have it. Recognition and awareness of warning signs and timely intervention can mean the difference between early detection and treatment of kidney disorder or kidney failure, which could end up with dialysis, kidney transplant, or even death. Subscribe to the channel and stay tuned with us till we get back to you all with yet another amazing video of the wonderful facts leading a step to a healthier, easier, and beautiful life.